Welcome to The Digital Patient, where we discuss the latest advancements in digital patient engagement and share stories from the front lines. I'm your host, Alan Sardana, and with me as always is Seamless MD CEO, Dr. Joshua Liu. Today we're joined by a very special guest, Harshal Shah. Harshal is currently the Director of Digital Health at RWJBarnabas Health. He is a goal-driven, compassionate, and value-driven professional with years of related hands-on experience in fast-paced healthcare settings. Equipped with the first-rate management skills in developing and transforming visions and plans into strategic and effective actions to drive successful goal accomplishment, Harshal is commended as an effective and results-driven director with strong supervisory capability in integrating and regulating systems to enhance total quality of care as well as maximize operations and financial resources. He has strong financial expertise in analyzing, budgeting, and developing cost reduction initiatives, and he is recognized for his ability to translate corporate vision and mission into division-level strategy in order to meet and exceed financial and organizational targets, maximizing asset utilization. Harshal, welcome to the show.
Thank you for having me, Dr. Liu, Alan. Pleasure to be here.
Please call me Josh, please.
Well, Harshal, it's great to have you on the show. You've been honestly hyper-focused on patient engagement for over a decade now. Maybe didn't sneak that into the bio, but that is absolutely the case. Prioritizing bridging the gap between patients and providers as well as IT and clinical. I'm really curious to start the conversation. What spurred your initial interest just to get into healthcare?
So my initial interest started when I went to Buffalo and decided to do a 6-year doctor of physical therapy program. 3 years into it, it wasn't for me. I realized that. Then I realized that I really wanted to know what's happening from the back end standpoint, what the day-to-day function is. How does a patient even get to an appointment? How does a patient even interact with our health system? So kicking that off with my bachelor's degree, I kind of went into some of the patient complaints perspective. And when I learned more, I wanted to know more. So I then enrolled in an MHA program at Seton Hall University. And there I met one of my mentors, my first mentor, David Gorley. And he was teaching about emergency management and different perspectives. Went through patient engagement experience. But the way that I was taught this whole healthcare overall, it ignited a passion. It ignited that we need to make changes. As a health system, we need to drive change. We need to evolve as the patients is evolving. So that really spurred up my healthcare interest. And my first role, surprisingly, was because I was able to fix a PowerPoint for one of my professors. And he's like, "Oh, that's awesome. I have a job for you." So then my role in healthcare at Chilton Hospital, now it's Chilton Medical Center, came as a policy management associate. So that's how I got my entrance into the whole healthcare field. And then when you start thinking about what goes into a policy management, the conversations you have to have with department leads, directors, understanding the workflow, because policies you can't just make without understanding the full scale of the workflow. So this gave me a chance to learn about all these policies, the workflow, the operations, clinical, patient experience, every perspective. I got a whole lot of education during that first role. And because I was so technical as well as more operational, I got into patient engagement. And, I kicked off my career doing that at Chilton Hospital. Then I went to Hoboken University Medical Center doing assortments of basically joint commission preps, regulatory components, engagement scores, and how do you improve them, strategies to deploy. After I focused on that, I was actually called back to Chilton to launch their very first patient portal. And that itself was a whole big project because it was it was like 2013. Patient portals were still kind of reeling in components of understanding what a patient wants, what a clinical perspective can provide. So it gave me a lot of workflow analysis background. It gave me a lot of interactions. It gave me a marketing perspective that I needed to bridge all those gaps. Although this was technical, this was more patient focused. We had to make it more patient centric. We had to understanding meaning a point of view from a patient of what they go through on a day-to-day basis, whether you're an 18-year-old, whether you're a 40-year-old, whether you're a 65-year-old, understanding the different perspectives and what barriers they're encountering. Without understanding that, we are not going anywhere.
That's awesome. I'm curious, when you were employing that portal back then, how much of that were you kind of like dog fooding your own product? Like how much of your time was personally spent kind of going into the patient portal and like going through different patient journeys or
I did a
maybe
lot. Yeah, I did a lot of that. This was a net new portal for the hospital itself. So you had to understand the nuances, and we got into access standpoints. How do you sign up? Password check. What results are coming through into your portal? Okay, if the results are coming through, how are the patients going to understand it? The marketing components around this. So it was a lot of this, what I do, and throughout my 12, 13 years of doing this, I was on the move and always learning. Because without continuous learning and lifelong learning is something I focus on across the board, even from what I do in my role today, even what I have a team for, even when I speak to one of these podcasts. It's lifelong learning is such a journey that there's no end to it, and you continuously improve yourself to betterment for your patient.
So Harshal, we know you're not just all talk about lifelong learning because you haven't mentioned yet, but you did your MHA and then you worked in the provider space and then you actually went and did your MBA as well.
I did.
What was the motivation for doing your MBA, and then how did that end up shaping what you decided to do next?
So, when I did my MHA, I needed to understand the whole healthcare journey. But at the end of the day, healthcare being a business, we needed to understand the business and perspectives of administration, analysis, financial components. And I thought that was so important because then I can take my journey from my MHA, collaborate that with my MBA journey, and understand how those things work together. One of the key things I learned in this whole healthcare journey and as my MBA class is negotiation skills. Just important perspectives, but then you get to understand like a patient, yes, equivalent to a customer. A customer has so many options. They're not just going to your hospital or a healthcare organization. They have so many options. Why are they important to you? Why are you important to them? So that's part of the.
Actually, this is really fascinating. Sorry to go off track on the
agenda,
but I guess now, so you have your MHA, you have your MBA, so you have both the healthcare mind, you have kind of like the business kind of chops as well. Does that mean that now in your role, like, are you also getting into like marketing as well? And I'm just curious.
So my role today, my true title to form is Director of Digital Health, but I work with internal teams. I work with marketing. I work with regulatory. I work with legal. I still do policies to an extent. But the key around this is that you're part of a bigger team in your healthcare organization. And you understand what they have to go through. We understand what we have to go through. And it was so important for me to learn those perspectives because then I could help my teams that are internal to me to help move things along.
Yeah, makes a lot of sense. And Harshal, I think it's neat that you brought up the idea that the patient as a consumer or as a customer, they have so much choice, what's in it for them to actually choose the particular health system. You've shared in the past that patient experience is one of the most exciting aspects of healthcare today, and also how the patient journey and the experience begins well before a patient even gets to the hospital, and it ends even after they've left the hospital. Can you unpack a little bit of what you mean by that and how that fits in with how you're thinking about patients and consumer discovery?
Yeah. So my daughter's 2 years old, and I'll use a very personal example. When she was born, I had to find a PCP that would be good for her. I had to find all this. I didn't just go on to our healthcare organization website. I did my research. I Googled the physician's name. I Googled who they're part of. But understanding those components is so important. Even if you Google a product today, as an organization, you're providing a service. But as a customer, I can Google one product and I get hundreds of reviews. I can get where to get the product itself because that product is the same everywhere. So what's so important? How do we distinguish ourselves that we are a core essential patient-centric model that's going to be right for you? So understanding when the patient starts their journey, it can't just be I'm walking into a facility or I'm going online to schedule. It has to be all those other perspectives, understanding that, okay, what are they actually going to search for if they want a primary care provider? I want this, and this. There's a criteria that's already ingrained in a potential patient's head before they even go and do this. They have the questions. How do you give them opportunity to ask those questions? How do you interact enough with the patient to understand the patient? Like we do a point at the point of care today, right? At point care. Across the board. we need to focus on all-inclusive care. We need to focus on that 360 model. We need to understand the patients, their day-to-days, what are they eating, whether they would like to tell us as a healthcare provider, or we find out from Apple Watches, Samsung Watches, Fitbits, whatever that would be. Like even to the point of, hey, you've been weak a little bit. You're dehydrated. How much water have you been drinking? Like just imagine that conversation having a provider or patient interact. Like how valuable is that? Not even making sure the data is there, but making sure the physician's aware that it's there. And how do you utilize that? So a lot of our patient experience journeys, we do at the time of service care, at the time of this, at the time of that, your annual physical, your Medicare annual wellness visit. But how do you incorporate into a larger scale? Like we have your phones today, we have Amazon today, we have all these tools. They tell you, oh, hey, it's been 3 months since you ordered toilet paper or paper towels or diapers. It's time to reorder again. Like they prompt you, and you can make it easy as possible for yourself. Like how do you do it for a patient in healthcare?
Yeah.
And that's where we have to kind of tweak how we're thinking about this. We have to think about, okay, the patient's there, this is their lifestyle. That's where data comes in handy too. Like taking all this data that's already out there, how do you utilize that data into a meaningful conversation?
And RWJ over time has become a very, very large system. And I'm curious how you think about rolling out these sorts of digital innovations. Do you start small and kind of grow? I know some systems go with a pretty big bang. They go all in from the start. I'm curious how you think about scaling out innovation, given how large the group is now.
Yeah. So, I mean, we're going through an epic journey ourselves right now. We're halfway through our epic journey. And we as a system, we're focused on access, right? Access to our diversified patients that we have across New Jersey. But we have to understand two things. If we roll out a big bang of a product, maybe we miss a lot of access for patients that need it. So we started to think, okay, how do you kind of categorize this into an access journey for a patient so they can get what they need? And our system, we've come from multiple portals, we've come from multiple patient portals, multiple EMRs. So our main focus right now is to make a single access front door for all services that are needed. And that's what we're trying to encourage doing, right? So whether it be telehealth, whether it be results, whether it be e-visits, whether it be scheduling with a provider, getting a referral, scheduling your CAT scan, proxy access, completing your consent. We want all that into a single access. So you don't have patients going to different areas. Oh, I forgot my password. I forgot this. Is this where I go for this? But all this access is right at their fingertips, whether their app or on their computer. So we want to make it easy. I almost like to say that, what Amazon's doing, what Walmart's doing, what Target's doing, like a single access app across everything. That's what we need to encourage doing. But for healthcare, we have to have new restrictions, new protocols, new security in place. So as we are improving, we're also improving along with that.
That's really great. Speaking about telemedicine and telehealth, Harshal, at the beginning of the pandemic, I watched a webinar with you. You had a very profound statement, I would say. You said you believe that telemedicine will become its own service line. It's a very interesting way to think about what telemedicine is and how policy can be shaped around it. I'm curious, what type of future would that look like to you where telemedicine is its own service line, and what would need to happen to make that possible?
Well, 100% on policy changes, right? We have to have a lot of different policies in place, reimbursement for commercial payers. But, when I think about telemedicine, it's the mode I'm thinking about, right? You're in person, you can get your typical patient provider interaction done in person anywhere you go. But you are literally just changing the mode of communication. That's all you're doing. Your relationship with the provider should stay the same. Your standard of care should stay the same. So it doesn't matter why you are seeing a physician or another provider with telemedicine or for a consult, whatever it is, you're making it so it's easier for the provider, easier for the patient, and it gives much more opportunity for the patient for various access scenarios, right? They don't need to take off work. They don't need to drive anywhere. For an oncology second opinion visit, they may have a 2.5, 3 hour journey from their house to here and going back. That's a 6 hour day. I mean, just imagine the driving around that. You don't need to do all that. Telemedicine is creating new opportunities. And when we say telemedicine, it's patient provider, but there's also the overarching of telehealth, right? So you have your e-visits, you have your e-consults, you have your tele-ICU, tele-ped, tele-neuro, tele-stroke. I mean, there's so many opportunities, but you have to think of your standard of care is just staying the same, if not improving. You're just switching the mode. All you're doing is you're finding a different way of communicating.
Harshal, I just want to double click on that. So I was looking at some data last week from the Chartist group, and they had this really neat infographic where they showed that since pre-COVID, there has been a 10x increase in telehealth visits. But at this point, after kind of spiked and it's kind of like plateaued out a bit, it's still only about 10% of all outpatient visits. And when they looked at the data like by specialty, you kind of saw like a spike where, okay, we're seeing sustained telehealth usage in mental health and psychiatry, but for most other specialties, it's kind of like tapered off. And it's for some of them, it's gone pretty much close back to where it was pre-COVID. I'm curious, and by the way, I've heard mixed reactions. I've heard some folks say, well, we did a lot of telehealth because in-person was not allowed at the time, or we figured out that for certain specialties, telehealth is more effective or more relevant than others. I'm curious how you're looking at that now at RWJ and maybe some of the data that you're seeing since the pandemic.
Yeah, I wouldn't say it's completely back to normal or where it was pre-pandemic, but I think when I talk about telehealth, also I talk about at the same time it's comfort level. It's comfort level from a provider and a patient, right? As healthcare organizations, as a provider, we have to make patients comfortable with this idea that this is what we're providing, nothing is changing. We're really making it easier for you. And, in some instances, if we're high acuity patients, you can't really see them in telemedicine format. They may need to be checked up, or they may need to have a nurse go there and do a telehealth service. But someone needs to actually do a physical examination on them. That's a different story. But low acuity, I think that's a very low-hanging fruit. Let's make this happen. Let's make the patient comfortable. When you talk about what visits you can do, like your urgent care ED visits, low acuity ED visits, right? That are paid in cash or paid through, they're done telehealth today, the majority of them. Because parents, single moms, single dads, kids, they can't drive anywhere. They want easy access. They want this to be done in 20 minutes. How do you make it more effective? I think a lot of this has to do with comfortness of the patient. Like we're learning, we're teaching the patient, we're learning from the patient. But that's going to be so important as we go down this journey of digital transformation across the board. We're making ourselves comfortable. And I think I mentioned this at one of the Becker's conference panels, but we think about, we educate our staff, we educate our physicians, we educate every single person on the new technologies that we have going on. Then we expect patients to learn it on their own. So how do you bridge that gap? How do you make sure that we are doing the same thing with our patients and giving them opportunities to learn, giving them opportunities and a chance to ask questions? How do you do that more? You could put text on, your 24/7 support can help, your live chat boxes, doing webinars for the community. And that's probably one of the ones you saw that time. But that's what helps, right? And driving that patient to your organization, it could just be that easy because you need to educate the patient on what they need to do.
Such a great point, because better than we do that when you're implementing a technology solution in a health system, you do so much training for your providers. And yet when it comes to patients, we often assume, well, they can just log in and use it. Well, actually, everyone needs training. So I think that's like a really, really compelling point that we often don't talk about.
Yeah, and I think it's so important, like easy access to learning, easy access to knowledge articles, a way to ask questions. Like you're giving them that openness. You have to be very straight with them. Like, okay, if you need help, we're here to help. Before COVID, I had this is before Epic, when Epic started rolling out and implementing. I wanted to do an in-person class for the community that are going live with Epic and the hospitals are going live. I wanted to do that. But we found a different way of kind of doing that. It created the opportunity for patients to ask questions, that we gave them the forum to do that. And, one of the most important things that we've done as a healthcare system, we have PFAC committees across all the sites. We had a central one for our Epic implementation for patient experience. We actually got real patient feedback on how to improve what we're going to roll out with. even making it easy. Oh, I don't like the text on this side. It's easier on this side for a patient. If you don't click forgot password here, I want this to show up. So we were doing those simple things to help improve that experience. And as a system, because of what we did and the organizational kind of involvement, we've had, I think, over 40% of MyChart usage in the first 2 years, not even.
Wow.
And we're not even all live yet. So it speaks to a lot that you have to keep the patient the center point of attention. Equally, you're keeping your provider and staff the center point of attention. And how do you interact those two?
Harshal, I'm curious, and I think every organization does this differently, but I'm wondering, when you think about your digital patient engagement or experience kind of user metrics, is there sort of like a North Star metric that you tend to think about? So give me an example. So like at Facebook, I think they used to have this thing where it was, the goal was to get, I think, every user to get 7 friends on Facebook as quickly as possible, because that ended up being like the magic number for usage and growth. And I'm curious, when it comes to whether it's patient portals or other things you're doing, are there sort of North Star magic numbers that you tend to aim for that tend to really predict high engagement with patients digitally? Or
so I'll give you a little story on that one too. So we came from multiple different portals, right? We never focused on portals. We never focused on that journey before, because we had 2 or 3 patient portals across the system, multiple EMRs. But this time we have an opportunity to take a step back, reassess, and we did. What our primary goal right now is to make sure our patients are engaged with the health system with that single access front door, which for us is MyChart. So that activation rate of patients utilizing it is so important to us, because that tells us, okay, you've logged into your results, you've logged into communicate. And each go live, we're seeing increase, which is great. And when we get to a successful full implementation as a system, we're going to take that number. We're probably going to do more with it than we are today. But this is, again, patient experience is a journey. So this whole thing is a journey for us, even digitally transforming our processes for patient, for provider. But that's number one thing we're looking at. We want to give them access. Then we start looking at, appointment rates, probably in scheduled appointments. But those rates are going to be baseline for us that, okay, how do you improve this? And we're continuously working on improving components of how do patients engage with us? How do you make this easier for a patient? Before we didn't have proxy access. That was limited. Now we do for all age groups, and there's possibility of doing that. And that helps parents, helps single moms. It gives them the opportunity, and again, gives them a forum.
I appreciate that perspective on the journey that is patient experience, and understanding the feedback loop and listening to the patients and how can we make those improvements. You also shared, I think it was either the same webinar or another one that you were on, but you shared how you believe awareness and efficiency are the key drivers for digital transformation. And I think that's so relevant with what you're saying around patient feedback and making it this journey. Could you unpack how you're thinking about awareness and efficiency, and how you leverage those 2 foundational skills in order to make decisions for your digital transformation that you're doing?
Yeah. So if we think about patient as a customer as a patient, if as a business owner, I'm not aware of what's happening with my patients and their experience, what do I get out of that? I get nothing. I don't see any value in that. So we have so many opportunities to interact with those patients that we're asking, whether it be through our HCAS, whether it be through our rounding tool, any whatever survey tools we're doing. We're also given the opportunity to give us feedback. How do you take that feedback and put it into place? Put it to improve the processes that you're working on already. Interact with that. Being aware of a patient and their journey, being aware of a physician's struggles and the barriers to burnout, nursing struggles, staffing, understanding those 2 key players, right? You have your employees, you have your patients. You need to understand awareness across the board to improve what that core is going to be. Because without, you can't just have working on this, then physicians are being burned out or nurses are having a hard time. But how do you collaborate, thinking both those perspectives and making a unique assumption of what you're hearing? How do you improve upon that? Because that's so important, even in digital transformation, patient experience, digital transformation, telehealth, whatever you name Right now, any change that you're doing, any innovation that you're doing, those two are your key stakeholders, right? Anything that you're going to do, if they're not aware, we have a problem. And that goes through anywhere from education, training, understanding their feedback, the surveys, making sure everyone's on the same page. But you learn from each other, and that's what the goal is. And that's what's going to drive innovation. Learning from your patients, learning from your employees, learning and engaging those folks.
That makes a lot of sense. Harshal, you've mentioned it already so far in this podcast, how you're learning about different age groups and they have different preferences. And in another conversation, you shared an excitement that you have towards AI and its promise to not only improve administrative efficiencies, but also to support clinical efforts. You mentioned chronic care management as one of those and assessing patient risk. I know you've also talked in the past about AI and leveraging data to understand choices amongst age groups, and that's why I bring that up. But I'm curious, what data so far have you collected and what insights have you been able to draw from the data in regards to AI? How is that going to be used in the future? How are you seeing it today?
So, it's just stepping one step back, right? So there's AI and there's machine learning, right? AI, I think, if you start looking at a lot of stuff, there's no proof that it's effective. Machine learning, on the other hand, with big data, that has proven there are some things out there that can work. But when you start focusing on some of the AI, we have to improve how we're collecting data. Or machine learning, we have to improve how we're collecting data. We have to utilize and find a meaningful way to utilize that data. We have our registration. We have all these other access points, patient portals. We're capturing so much data, but how do you effectively use it? That's going to be the journey, understanding and categorizing those kinds of data. You have big data coming in. We have tons of results, tons of this, but utilizing that and into your chronic care management, your CHF, your diabetes, understanding what that patient's journey is going to be with the same age group that has 50% correlation, whatever it is, but it creates that opportunity for us. And, as we started our Epic journey, we're collecting all the data. I think there's some extent of machine learning happening, but I think we still need more data to even do remote patient monitoring. I think we still need to do telehealth, right? Understanding those components, like your vital signs, what's being impactful. But I think, again, this is a learning opportunity that from a health system standpoint, that we're going to take on. And I think we already are to an extent. We're utilizing some of the components. We're learning. We're doing a lot of research on what we're learning. But taking that research and putting it into place and putting it into real-time patient care usage, that's going to be the journey.
So one of the other, as on topic of learning, Harshal,
Yeah.
And learning maybe outside the organization, you've been a big proponent of collaboration with other leaders in healthcare. So, right now you're the president of the American College of Healthcare Executives in New Jersey, and certainly must have been very challenging doing that during the pandemic. I feel like in healthcare, there's kind of this weird situation where on the one hand, you're all trying to improve things for patients. So you want to collaborate with other local organizations and leaders. On the other hand, in some ways, you are competitors in trying to compete for delivering care in the system. So how do you sort of balance that collaboration and healthy competition with peers in these sorts of chapters?
So ACHE itself is a professional development nonprofit across the board, right? The national one resides in Chicago, but there's a good amount of understanding across all the health systems, even nationwide, that we're here to learn. It doesn't matter what institutions you're from, we're here to learn. And the focus of all those topics that we go through at ACH New Jersey are, kind of pre-written a little bit, but we modify them to what's going to be important at that moment. We had to switch gears, learn about COVID, learn about burnout, learn about administration, financial burden during COVID. But understanding all those topics is so important. And as much as we can say we're competitors, we're here for the same goal, the betterment of the patient. So in ACHE, I'd probably call us partners.
When you're at these meetings, are there one or two strategies that you use to influence or to foster more of that collaborative approach of getting input from everyone?
So a lot of leaders in New Jersey that are partaking in any of those panels that we have, they know each other from one or the other. They may be aware of each other, but it's also an opportunity for them to meet each other. Before I was president, before I was on committee roles and the board roles, we took time to prep. We took time to make sure everyone was introduced. We took time to go through what the key questions are, the conversations. And right now, the whole ACHE board and committees do it right now. Right? I don't have a lot of hands-on that besides, but they're focused on that. But one of the best things that I can tell you, it's so inspirational to hear that initial conversation when they're even interacting for the first time, that they get to know about each other. And they get to communicate with each other before, whether it be from competitors, but that doesn't matter. It's all professional growth and learning. And it's so vital because you may be experiencing a problem that's not competitor related that you can just talk to this person about. Everyone has a journey to go through. We may have ours, they may have theirs, but it gives them a forum to collaborate, have a conversation. It focuses a lot on networking. And that's one of the other goals, and it creates opportunities.
I have a question that's a bit off topic, Harshal. I think you've had this fantastic journey of getting into this relatively new category of digital health on the provider side, and I'm sure there are a lot of folks who are kind of up and coming in their careers who would ask, well, Harshal, how do I get to where you are? Do you have any sort of recommended paths to get to the point you're at, or would you just tell people, just follow your curiosity and you'll end up here if it's the right fit? I'm curious how you guide young professionals who are looking to break into digital health leadership.
So I'll give you a little story on that one too. But when I started my career, and I mentioned earlier that I started just by simply saying yes to help my professor doing a PowerPoint presentation because he couldn't get it on the screen. But that created an opportunity for me. Ever since that point, I have said yes to the majority of everything. I've said yes. It's not because I just want to be a part of it. I can't take anything else. It gives me the opportunity to learn what I'm being. And everything I've done over the past 13 years, I have been, here you go. Let's get it going. And I've learned. And that creates so much inspiration across the board. It creates motivation for me. I love doing what I do. So any young professional that wants to get into it, learn, be curious, create opportunities for yourself, have a conversation, network. Across the whole thing, it's being curious to learn, curious to know.
I love that. I mean, it's great that there's stories like the PowerPoint one where you said yes and you did and it led to something. But I think it's probably fair to say there were things that you said yes to, which maybe ended up being not as useful and didn't end up making the story. But I guess we often don't hear about the counterfactual where you also said yes, I'm assuming, to things that maybe you could have lived without, but that's just part of the journey.
And that itself is a curiosity that I needed to do.
Sure.
I said yes to something, I did it, but I learned from it.
That's true.
And that's how I'm a lot of your professional development and networking opportunities, your growth, career plans. We do it. An ACHE, I do an assessment every 2 years. It's a leadership assessment. But they ask you the same set of questions. How have you improved upon yourself? Have you tried new things? Have you done this? What kind of leadership? But you take those opportunities. Doesn't matter what they are. All opportunities create a pathway for the future. And being curious about all things, it gives you the options. I didn't 10 years ago, if you asked me where I was going to be in the healthcare space, I would have been I have no idea. But going through all these doors that I went through, it gave me the chance to be where I am today. So being curious, it piqued my curiosity, but it also gave me opportunities to learn, to teach, to have a mentor. Mentoring is so important as well. Learning from you're guiding your other folks across the path that you've been to. It creates one of the things that is so important in this whole journey. And I've said many things about creating opportunities for yourself. I've said conversations of communication across the board, right? Take the opportunity to meet someone, have a conversation, but it's you have that relationship. You're building a relationship, and that's what half of healthcare is about, if not all.
I love that. It kind of reminds me how, if I think back, just for example, when you started getting into healthcare, that was, over a decade ago. And correct me if I'm wrong, but I think a decade ago, I'm not sure if the term digital front door existed in healthcare.
I don't
And
remember using it.
Yeah.
right. And if you weren't willing over the years to learn and be curious, you would be still in like the digital health stone ages. But because you're willing to be curious and learn, you can adapt to when the environment changes, when you have to learn and build a digital front door for the very first time in healthcare history and all that. And being curious allows you to kind of move forward in this new environment. So that seems so important.
Yeah, I mean, we're all in healthcare, right? We have so many changes in healthcare, in conversation. Adapt is like the overlying term of healthcare, right? You name it, you have to adapt. You're adapting this to your organization's needs. You're adapting a policy to your organization's need. Insurance and commercial payers change all the time. The contracts change. Oh, we have to adapt our patient care to that. So you're adapting continuously. Now you're just taking that and adapting it yourself.
Yeah, I love that. Harshal, another question that I have, today there is this explosion of patient-facing innovations. I'm curious, which patient-facing innovation do you think you will adapt to next? For example, I'll just throw some out. There's chatbots, there's digital care journeys, remote patient monitoring, etc. Is there anyone that's, top of mind for you today, or any type of technology that's on the horizon that you're excited about?
So, I mean, you named the two that I'm already working on. So, our remote patient monitoring, the chat box that we're going to be doing. But, I'm going to go back to that first statement I made. How important is that patient's journey, that customer's journey, and where does it actually start? Understanding their needs. And I continuously look to improve, or how do you actually reach a patient at home? How do you actually provide care when they're at home without them even stepping out of the house? We have elderly patients that have a hard time coming to us because of transportation, because they're on public transportation, or they can't find a taxi here. And we're in New Jersey, we're so diversified in terms of population. How do you provide care to those who need it, right? How do you meet that or bridge that gap of providing that care? And that's what's important to me. And we can do a lot of innovation, but impactful innovation is what we need to do.
Right.
And so a lot of what I'm going to be focused on, or I already am, is impactful innovation to improve a patient's quality of life and care.
Awesome.
Yeah, I love that. All right, Harshal, being mindful of your time, let's flip over to what we call the Fast Five lightning round.
Just God.
5 rapid fire questions for you. The first question we have is, what is your favorite book or book you've gifted the most?
So I'm a big fan of the Inspirational Leader by Gifford Thomas. Yes.
Awesome. Question 2, who is a person, either dead or alive, you'd love to meet?
Jeff Bezos.
Yes. Yeah.
I actually want to meet him because I think Amazon has improved a lot of customer perspectives, like I mentioned, a couple of times.
That's
how are you doing that? What algorithms are you using? But a conversation would be great.
Yeah.
Well, since he's no longer operating day to day, he should have more free time for you.
There we go.
Yeah, we'll make that happen, Harshal. Question 3. Yeah. Would you rather have super strength, super speed, or the ability to read people's minds?
So super speed. I feel like at the end of the day, I always say I don't have enough time. So I think super speed would be very cool.
Mm-hmm. Nice. Question 4, what is something in healthcare you believe that others might find insane?
Ooh, that's a hard one. Oh, you know what? I'm gonna pass on that because I think there's a lot of things that I believe that others may actually meet. Because when we start thinking about the patient journey and digital patient experience, if I tell a statement to we're trying to make the Amazon of healthcare, or we're trying to do the Walmart of healthcare, oh, how are you doing that? What are you doing with this? So I get a lot of questions, but I think those opportunities are more to speaking more than anything. But nothing will find that insane.
Maybe not insane. Yeah, I get it. Last question that we have. This is more of a pandemic lockdown related question. What is one hobby or activity you've gotten into since the beginning of the pandemic?
Okay, no one laughs. I've become not a certified, but I've done a lot of electric work in the past 2 years in my house. My house is halfway smart house now.
Oh, that's awesome.
I'm still pending.
Yeah.
Behind the desk, I don't know if you can see it, but I still have boxes of like switches and wiring that I'm working on. That's my hobby that I picked up.
Oh, that's awesome.
Pandemic.
So do you not at all like physically turn the lights on anymore? Is it all just voice, or what are you doing?
Yeah, my top floor is all voice activated. There are switches there. My whole basement is 3/4 activated. I'm still
Wow.
working on the other side of this basement with the wiring. And it's hard to do with I can't have the kids home, because if the kids are home, I can't turn off the power.
Right.
So I have to do it when I have actual time. But it's a great hobby. It gives me something to do. I think the smart functionality around it. We talked about Alexa, Google, integrating healthcare into that, creating your own app. So that's the next step. But thinking about, using what they're using it for today, it gives me a cool kind of outlet.
Yeah, that's
Besides
awesome.
spending time with my kids, of course.
Cool.
Yeah, I was gonna say, like, the way to balance your day-to-day job of digital health is to go home and work on digital house. That makes sense. Yeah. Yeah.
I love it. I think a lot of even the wiring, like even the basic, like replacing a fan and all that. Like,
Hey,
I learned what to do, what need to, make a couple of mistakes, but I
Yeah.
learned from
there you go,
mistakes.
learning again. Yeah, no, that's awesome. I really like that.
That's
Um,
cool.
well, thank you, Harshal, for taking the time to come on the show and share some of your wisdom with our audience. That's a wrap for this episode of The Digital Patient, hosted by Seamless MD. You can follow us on Twitter @SeamlessMD. And if you like the podcast and you want to learn more, visit www.seamless.md. Harshal, again, honestly, thank you so much for taking the time.
Thank you
with
for
us
having
today.
me. I
Thanks,
appreciate
Harshal.
it.